The only thing I'd add too about your, when am I first needing health insurance? So there's a lot of times when it isn't always just solely a age 26 thing. There's a lot of people that call me who they've lost their job for the first time in their life, where they've always had health insurance through a company, and now they've been tasked with having to figure out what do they do. And that can happen again across the whole entire age spectrum, or they get married and how do I combine my insurances together for the first time, or I'm having a baby and what does that do to change everything? So all these life events can create a first opportunity of dealing with a problem you've never had to before. And those are what we at MB Health Advisors like to kind of help you take care of as well. Tell me when we're starting.
Oh, it's already
Oh,
running.
for Pete's sake. So it's actually running. You're going to. I'm Dan Jung with MB Health Advisors. And ultimately, I'm just going to take a few seconds here to talk to you a little bit about when you find yourself needing to get health insurance for the first time. The bulk of that scenario is when somebody's turning 26 and coming off their parents' plan. I get that call often, and I'm like, what is it that I'm going to do? How do I start this process? For me, it's a couple quick questions. One, what plan do you currently have and coming off of, and how much does it cost? Because one of the options is carrying that plan on for up to potentially 18 months. And that's a real viable solution because the plan you have can typically be a full network. You're used to it. It may travel good with you. But then at the same time, it could be pricey. So if you're starting out on your own with health insurance and responsible for the premium, continuation is the full cost. That's where Obamacare / the Affordable Care Act is the true name for it, is where a lot of people try to find out, can I do something a little more potentially affordable, not just in price, but also in product, in terms of deductible and co-insurances. So that's when we start to discuss, what's your income? What job do you have currently? And then we take that number, plug it into the system and see kind of if that gets us a subsidy, apply that to a plan, and then see if the network and when it fits for you. And when I say that, I'm talking about your doctors, your hospitals. And then we kind of develop a strategy just around your care. And then basically get you put in place. We have 60 days from the date that you turn 26, at the end, typically at the end of that month. So if you turned 26 today, you probably have to the end of January to get another plan or product in place or keep the same plan you have. So you have 60 days to make that happen. And once you get outside of that, then we lose options. Now we're only looking at short-term plans or tri-term type products through specific carriers. And we kind of go through all those and just depends on where you're at in life that an option could make the most sense or not make the most sense. There's so often when you're out there and you're confused and you see so many products that you just don't think that there's something that I can afford. One of the things so many people do is they just assume I can't get health insurance. I can't afford it. And so talk to a professional, talk to somebody that's all they do. I've had 20 years of trying to help people figure out what's the best thing for them to do with their health care. And I can't find solutions, but I just first have to listen for the problem and help you figure that out. Don't be afraid to go get it, to help with it, because there are ways to do it. When I look for a plan, I'm always pretending that the situation I'm talking about is mine. So if I'm you and I'm turning 26, what I'm looking for in a plan is going to revolve around really what my health of myself is. If I'm dealing with any types of medications or I have specific doctors that I want to see or certain types of care that I need to make sure is covered, well, then I got to make sure I'm picking a plan that meets that criteria. And that isn't always the cheapest plan. That isn't, it isn't necessarily the most expensive plan either. Okay. And then I also have to try to think far out. I don't want to just do the right here and now. How do I want to plan to make sure I've got the best price and product, at least for a year? Because most of the time, once you get into these plans, you can't make changes until the open enrollment. on an individual product. The biggest thing is just guidance. I mean, so many folks when I call them, it's a product in terms of the health insurance that they've never had to think about. You know, if if you've had to think about your health care a lot prior to turning 26, well then you've had to use it a lot. You've got conditions and issues, but most of the time it's completely uncharted territory. And so the guidance of how do I do it? What should I be looking for? What factors play into it? Those are the things that I kind of I love to be able to help mold and figure out per each case.